Welcome back to Good Morning Connecticut at 9. We are going to start off with today's health headlines for this half hour. It is Lung Cancer Awareness Month, and today we are learning more about groundbreaking research and some innovative treatments. They're making a real difference for patients diagnosed with lung cancer, which remains one of the most common and deadliest forms of cancer. Joining us this morning to talk about some recent advancements in lung cancer is Dr. Sarah Goldberg, Chief of Thoracic Oncology for Yale Cancer Center and Yale School of Medicine. Dr. Goldberg, thank you so much for being with us this Friday morning. Let me start out right here. Lung cancer is often thought to always be tied to smoking, right? But there are some other risk factors for lung cancer, and a person's genetics can also be a factor, correct?
You're right. Lung cancer is most commonly linked to smoking, but it's not just people who currently smoke. Even smoking in the past, even many years ago, can lead to lung cancer. So it's really important to keep that in mind, even if someone smoked many years or even decades ago. Some other environmental risk factors can be a risk for lung cancer. We think that radon can lead to lung cancer in some cases, but there's a lot we don't know about what causes it. And even people who've never smoked and have no clear risk factors can be also diagnosed with lung cancer. Genetics plays a small role, but it's not as much of an inherited disease as other cancers like breast cancer can be.
Okay. Doctor, in recent years, there have been some pretty major advances in lung cancer treatments. Can you tell us about some of the new therapy options that are available and how they're giving patients more hope than ever before?
That's exactly right. We've seen so many amazing advances in lung cancer treatment in the last few years. We have targeted therapies where we could figure out the right treatment for the right patient at the right time. We're really using details of what's happening in the cancer to pick the best therapies for them. And then also immune therapies have been incredible. We're using the patient's own immune system to fight the cancer, and that's really making a big difference for patients. People are living longer and living better because of the treatments.
Now, with almost every medical condition, we hear early detection is really key, game changer in many respects. Are there new screening methods that can help catch lung cancer a little bit earlier on?
This is so important. The earlier you find cancer, any cancer, including lung cancer, the better the outcomes. The earlier you find cancer, you can cure the cancer in many of those cases, whereas later on, it's harder to cure. So catching it early is important, and that's why screening is so important. So we've known about breast cancer screening, colon cancer screening for years. Lung cancer screening is a bit newer, but we now know that in people who are at higher risk for lung cancer, it could find it earlier and it can save lives. So that's done with a really simple CAT scan. It just takes a couple of minutes, and it can find lung cancer early and help to cure those people that may have a lung cancer they don't even know they have. So absolutely important to know that exists. And if someone's at risk for lung cancer because of a history of smoking, they should consider getting screened.
How often should most people, say, in middle age, get screened?
If someone has a history of smoking, since that's still the main risk factor, they should talk to their doctor about getting screened. And then typically we would think about doing it on a yearly basis.
Okay. Dr. Goldberg, thank you very much. We appreciate your time.